Hi, my name is Malecki, and I did my journal article on low-load prolonged stretching versus high-load brief stretching and treating knee contractures. I got this article from the American Physical Therapy Journal, and it was done in 1984 by Kathy Light. The clinical question that was done in this article was which knee stretch will increase active range of motion and reduce the contractures of the knee in non-ambulatory elderly patients. So they looked at the high-load brief stretch, also called the HLBS, which is the traditional method, and it was versus the low-load prolonged knee stretch, also called the LLPS. So the subjects were 11 geriatric patients who were in nursing homes, and they had bilateral knee flexion contractures, and these contractures they had for at least 3 months, and they were at least 30 degrees short of their full range of extension. And they also had an inability to walk or transfer without maximal assistance. The methods that they used, one lower extremity, since they had bilateral knee contractures, one lower extremity received the LLPS and the other limb received the HLBS. So the HLBS, which is the traditional method, they would receive 10 reps of the passive flexion, adduction, and external rotation using PNF methods, and they followed it up by a routine forced manual stretch. And the forced stretch was just a normal stretch that you would typically see. The total time for the HLBS was 15 minutes, followed by a 15-second rest, and then it was repeated 3 times throughout for the total treatment. The LLPS leg, it was actually placed in a traction device. It was made of buckskin, and at the end of it, a milk carton was full of sand, and it was used as a weight, and the weight would increase each week. And once that sand got the leg to end range, it was maintained there for 1 minute, and then the weight was reduced for 15 seconds, and this treatment time was done for an hour. And this leg with the LLPS was moved with a force and velocity that allowed the soft tissue to accommodate to the changes in the range of motion until the end was reached. And here's a picture of the traction device, and you can see the jug here and the pulley system and the traction on the foot. And the results, they took 2 types of results. They measured 2 things. In test 1, they compared the pre-treatment and post-treatment of the passive range of motion in the LLPS leg. And in test 2, they did the difference between the LLPS and the HLBS passive range of motion. And in this chart, here's the subjects, and here's their range of their LLPS and their HLBS. And this was pre-treatment and post-treatment, and the changes between them. And here's the differences. So this would be the first test, and this would be the second test. And you can see that with the LLPS, it improved. So the clinical significance of this is that the LLPS, it's a simple procedure, and it can help produce elongation of the tissues, and it help improve the passive range of motion. In the study, it was found to be a more effective stretch in treating contractures, but the limitations to this study were that it was a small study, and they were all elderly nursing home patients. And after this, none of the patients became ambulatory, and they still all required maximal assistance. So that's the end of my report. Thank you.